Hi everyone, James Sneddon. Thank you all for coming. I'm here to talk about our scale up now, Hyphen Health. Okay, so Hyphen Health. And I'm going too fast. So we began this service because doctor's appointments suck. Now, sorry to any doctors in the room, but basically I was sitting in the waiting room one day in 2014 and I was like, I'm there for my 11 o'clock appointment and I get to see the doctor at 1 p.m. You know, I was running a restaurant at that stage and busy and just frustrated. And then I thought, you know, I lived in Merriweather where all the doctors live, and I was thinking, surely there's a better way. So we went from, I was like, you know, let's do, why can't I get a script from one of these doctors after hours? You know, I just need this short script. It'll take 2 minutes. You know, doctors want to come see me after they've been working all day. So then it pivoted into like a Uber for doctors idea, and then I realised the doctors are in demand enough. They don't want to work on demand, so which was totally fair enough. But yeah, along the way I met Dr. Tanner, and we identified that the perfect need for, we can't do an Uber for doctors, but what would be the perfect appointment for a doctor online? And we thought sexual health. And yeah, lo and behold, there's academic studies that show that patients don't want to talk to their doctor about sexual health or STIs, which is a big issue. And then there's actually studies that show that doctors don't talk to their patients. They're not proactive in asking those questions because it's awkward. Like it's not, and if the patient's in there coughing and spluttering, you're not going to go, oh yeah, do you need an STI test? And then it's stigmatized too. So that question itself carries like an insinuation, which it shouldn't. But that's where we removed all that awkwardness with text-based healthcare. So yeah, traditional appointment, or a lot of doctor's appointments look like this, but to see a doctor for an STI test, you go see him or her, you get to the pathology, they give you a referral to pathology. If you've got symptoms, they may give you a treatment, but it's very rare. Like they will send you for tests to make sure they know what it is, to know what they're treating. You go to pathology, and then if you're lucky, your doctor will ring you and say all negative, or he'll send a prescription straight to your pharmacy. But often they will make you come back to them to get the results. So, excuse my baby Margot. So,
it's very frustrating.
Yeah, she's frustrated too. She's been to a lot of appointments. So we've got there's also the whole part that's not on here. You know, it takes 2 weeks to get to here, and then it takes a week to get back to here. Which is just rubbish. So this is what we've done. Well, now think sexual health, it's awkward, it doesn't happen. What we've done is we've just made it text-based so far. We've got a form. You fill out a form, and then you get a referral instantly. And I'll go through the storyline because instantly is not how we started. You take that referral, you could be like walking into a pathology clinic and we can give it to you there and you can get the test done. So when it's on top of your mind, you can get it. It says patient activated, which just proves results. And you'll see with our traction. So Hyphen Health is a house of brands now. We've got multiple clinics that are based around this pathology-led services because we've got a replicable model. So Stigma Health, STI testing, and then our next clinic we launched was Prep Health. I'll go into the timeline of that soon. HIV protection, we need an STI test and kidney function screen up front. And then just last year we launched Roid Safe, which is similar. People go to the doctor and go, you know, I'm on non-prescribed illegal steroids, and doctors would just be turning them away saying, no, my advice for that is just stop. And it doesn't work because there's a addictive nature of that drug. There's addictive nature of that drug. There's just a whole lot of reasons why people are taking them. Just turning them away is not good enough. So what we do is we give them a chance to get their tests, to start getting transparency over their results. And we are trying to turn them away, but steroid harm minimisation is our approach. But you've got to start, we're starting there with giving them people transparency. So now we're attacking this $200 billion Australian healthcare market through our niches. And so I get confronted about how niche sexual health is, which is very frustrating, especially like we're trying to raise capital and people look at this 764,000 STI tests. It's a very frustrating figure because there's 4.2 million Australians on Tinder, okay? Like everyone under 29, which the population under 29, I believe is close to 8 million. that should be getting, 16 to 29, they should be getting tested. They should be tested at least once. And the stats are horrible, like 15% of them have ever been tested. So you can ask your friends, have you ever been STI tested? There'll be people in here who have never been STI tested. You don't have to raise your hands. There is no stigma though. There shouldn't be any stigma to testing. So the market's actually huge. Sex is a fundamental part of what we do as humans. Sexual health is fundamental to your overall human health. So STI screening is so important. Similarly, PrEP, the market is estimated by the guidelines that 70,000 Australians are on PrEP. There's about 115,000 Australians on Grindr, a dating app, okay? In Australia, only 1% of men are identified as homosexual. In the US, it's closer to 4%. So we have an issue here with stigma, and where we try to think, we just have world pride and we celebrate how open we are, but really we only just got gay marriage. We're like one of the last to do it. We're actually we're not that forward. I think my baby might be leaving. So we can all do better. We can all do better. And I was teaching in schools this week, and the Snickers are still there when you're talking about this stuff, and you're just like, you know what? You who don't think you need the STI test, you're the guy who's not cool. Like, STI testing, like, not saying sex is cool, but it's just part of what we do, and it shouldn't be detached from sexual health. So, this is our team. Dr. Mitchell Tanner, my co-founder, GP, because people do ask what I do, and I just say I pretend to be a doctor online. You can do anything on the internet. And Dr. Tanner and I, we met in 2015. We've built a strong team. We've got a couple of assistants, but we really leverage our human capital. We don't have any full-time doctors. They all work. We only got two. Dr. Tanner, who doesn't do much medical stuff anymore. We've got Dr. Nichols, who does most of the work, and we're recruiting a third doctor now. And they work ad hoc because they just wanted a third job, these doctors. They're workaholics. We're working towards getting a dedicated health professional to lead our team, which is very tricky. But yeah, we use contractors. Brendan, who's here, is Hyperweb. And we've got Wayne from Novacom, who's been with us from the start and actually initiated our MVP becoming our product market fit. He made that possible. I'll explain that in a minute. We use contractors, small team. We run low overheads, and that's why we're profitable. So this is our timeline now. Back in 2015, Dr. Tanner and I were introduced by my rugby coach. I played for Merrill at the time. I now live in Maitland to play up there. Dr. Tanner plays for Singleton. They call him Dr. Head High. He lets out a bit of aggression on the rugby field. And it's funny enough, he works in the hospital later that night sometimes. So stitches up the guys he's chopped. But yeah, we've had good run-ins on the rugby field too, which is good fun. So we 2015, we registered our company. We met, and then we started, I launched MVP then. I just built a website, and I wanted our logo to be a duck because duck rhymes with, and I was playing on that, and it was really quite tacky and crass, but I built this site, and I didn't do any advertising, and I got 2 people sign up within a couple of days, and I was like, I better pull it down because we're not ready to do anything, but I had paying customers, so we got traction. 2016, we launched our minimum viable product in November 2016. So we did everything by the book. We waited for Medicare to give us a response to say they would cover the pathology testing. So our service, Medicare will only cover a doctor's appointment if you see the patient in person, or they'll only cover a telehealth appointment if you've seen the patient once in person. So they don't cover our service in particular, but they cover the pathology testing we refer. And it took months to get that confirmation that we were all good. And when we did, we launched, and we launched with this MVP, and it was really the hamster on the wheel. So, technology, everyone expects instant and automated, and that's what our customers definitely expected. But the patient would put their order in, I would upload it into the system, and then Mitchell would actually prepare the referral in the system. It was digital. We had to enter it all, put all the data in, like a normal appointment. It was, and we did that for years. So I kept the hamster going through the years. So 2017, we had a great sort of launch to market. We got a lot of initial press, which was great. This is the first version of our website down here. Pedestrian was really relevant. We got in Vogue. We got all this media attention, and we signed up, I think 400 or 500, maybe 600 customers our first 6-7 months. And then we ran out of money, because at this stage, just me and Mitchell put our money in, and we've just blown it. I blew it on AdWords when we were converting at 1%. Like, blew money real fast, so we spent, it was only 70 or 80K, and we probably could have put more, but we weren't, like, I had restaurants, I had a whole, like, this is a side hustle. And Mitchell had his clinic, you know, we just couldn't commit to, and that hurt the business for the next few years, as you'll see. So 2016 we launched, 2017 also I started to exit the restaurant industry. I tried to use this to promote the business, you know, James is raffle off his bar, giving it away, selling it for a medtech startup. And I really tried to get the business mentioned and get more hype. You know, I met Koshi and I was trying to mention it. We just did not get anything more than like a couple of sign-ups. People just, but they did buy bar tickets, raffle tickets, so successfully sold the bar. 2018, we're no longer spending any money on advertising. The business is just a side hustle, and we don't have the PR girl anymore. We still managed to get into Triple J just from, we're the only people doing what we were doing online. And we just noticed sales are just organically increasing. You know, we're doing 70 or 80 referrals a month. Not huge, but I mean, that's a lot more eye tests than most doctors do in a month. So we just we realised we're on the hamster wheel, but we realised we're getting somewhere. We realised this has legs. This is probably why, even though not much happened this year, it's probably why we stuck it out. So 2019, also 2018, I'm out of my restaurant, but I've got 2 babies now. You know, life just gets in the way, which is not an excuse. You know, some people put their life aside for their business. We've just had to mesh the two. My family's here now. I've put family first. So 2019, I've been writing to Tinder for years too. I was trying for years to be there. They need a sexual health partner. You know, there's academic studies showing that they're complicit in rise in infections. And they write back to me and send me an email saying, oh, we have nothing to do with sexual behaviour. And they won't work with me. So I just sent it to the Sydney Morning Herald. Actually, no, I had a rant on LinkedIn. The Sydney Morning Herald picked it up, and we got page 2, which is the closest I've been to the front. So we're getting there. But we're still in the hamster wheel. But December 2019, we hit product market fit, and we get out of the hamster wheel. Product market fit is instant pathology requests. Sounds really simple. We had to just get comfortable with being okay with this. But basically, the patient fills out their questionnaire. The questionnaire profiles them against national healthcare guidelines, which we've got to keep an eye on, and then gives them the tests that they need. Now, so when you get an STI test, people want to be tested for everything, including something they've heard about in South America that never has come here. They're just scared. When people actually get these tests, they want everything, but you can't do it because national healthcare guidelines are there to minimise Medicare overspending. So our tests are strictly to the guidelines, and if they want additional tests, we send them back to their doctor. They usually just accept what we've got, and we just got to keep on top of the guidelines changes. But they get a referral instantly, so they can walk into pathology and get it. And then all of a sudden, September 2019, we're doing 70 or 80 a month. January 2020, we're doing 300 a month STI tests. So product market fit is validated. So 2020, we're thriving, it's working, and then life's still in the way, but you know, back in 2017, we started discussing PrEP Health. One of my bar managers was on PrEP, HIV pre-exposure prophylaxis, daily medication to protect against HIV. And we launched PrEP Health in December 2020. I was personal stuff back at work contract finished, middle of COVID, I couldn't get a job, so I was like, you know what, I finally have back to the wall, I finally committed to this business full time. And that really makes a huge difference. You have to, I couldn't do it any sooner. I wish I could have, and I wish I should have, and whatever, but I finally did it, and we've just looked up ever since, and gone forward ever since. So, 2021, we got some angel funding on the back of PrEP Health launch. You know, we've proved we've got a replicable model. We're scaling. PrEP Health had, in its first month, racked up $50,000 in annualised revenue and was on track to be a $1 million annual business by the end of the first year. bootstrapped. We launched it with $2,000, but we launched it with all our skill set we had and accumulated over the years. And we launched it with an agreement with a ASX listed rapid HIV testing company, which we could no longer work with after a few weeks because the guidelines changed to say you can't use those tests to prescribe PrEP. Anyway, we just lined up everything and it launched with a bang, and it's gone really well. And that's 2021. We've really been in the growth hacking, just reinvesting, observing what's happening. We changed. We started off as a subscription business. We changed, and that's a big period of growth. On the angel funding we received January 21, I finally could start getting a salary from the business. We went to market to raise 300 grand in seed funding, I called it, but really that's not seed funding, that's angel funding. And we got 110 grand like that from angels, and then I was like, yeah, that's all right, I'm really good at this, I'll just get the other 190 later, and started spending the money, blew all that money, hired all this staff that you can't afford with 300 grand or 110 grand. But blew it, but we got to the point where we were operationally break even. It helped that a couple of those staff left because they didn't survive in the generalist nature you need for a startup. So they left, and then we realized we're breaking even and we don't need more money. After I raised another 30 grand just to get to that point where we're okay. And then since then we've been profitable. So 2022 was a big year. So these are my highlights of the year. We're just reinvesting. July we launched our third clinic, Roid Safe. We've really proved a replicable model. I don't know how many more times we can replicate it, but we've got 3 big growth channels now. I probably would like a 4th one, but I have no idea what it is, to be honest. And the 3 we've got, they can grow and add divisions. I'm getting some recognition. I got into a podcast talking about bootstrapping because 110 grand is still bootstrapping, and you'll realise that. And then I got accepted in the ITO Accelerator, which is really exciting for me because over the years I've applied for hundreds of accelerators, and they're like, weren't interested. I always said sexual health isn't sexy, I couldn't get investment for it, couldn't get venture capital interested, couldn't get into an accelerator anywhere, couldn't get into an incubator. And then back in 21 I started getting offers to get in, but we're already well ahead of where the equity they want and money they want. Luckily, ITON didn't take any equity, and I think Siobhan was like, so why do you want to get in? Like, your business is going places, but we really wanted to get to that scale-up stage. And I guess when you're doing it on your own for so many years, you don't know if you just don't know you got that imposter syndrome. And ITON really gave me some confidence and instilled, really ratified that I was on the right track, and really opened doors. I met Sarah, I met James, these are entrepreneurs, I met Glenn, these are mentors in the program, and it's just, we just really progressed. And we finished November 2021, we made the Financial Review's Fast 100 Fast Starters. So we made actually top 50 fastest startups in Australia in the Australian Financial Review. Coming at 42nd, and we're behind Eucalyptus at 39. They've raised $103 million, and we've raised $140,000. But we're on that same page. So there's more on that to come. So Eucalyptus owned Pilot, Infertility, you may know some of these. 2023, we're starting to get some recognition. I got on my first panel. I was quite awkward extra guy on the panel, but I was really excited. They drew me up in a cartoon for the podcast, and I'm here telling my story. We're getting, and this isn't just about me, but obviously I'm the face at the moment, face of sexual health. We've realised we're now Australia's largest sexual health service, and we have an unfortunate Medicare audit recently. Well, not unfortunate, it's just any audit's awkward. And we found out we are officially 1 in 2 in prescribing PrEP, and we're 1 in 2 in STI testing referrals. So we are the largest sexual health service in Australia. Now, we've got close to 3% of the market. It's very fragmented. There's 16,697 prescribers of PrEP, but we beat all of those. So it is fragmented. But we've also realised next is, I'll get to that actually. I'm jumping ahead on the slides. This digital health conference is my next speaking engagement in June. I'm excited about. So I'll hopefully get better at this. But I'm on a panel with one of the founders of Eucalyptus. So I'm just like, he's raised 103 million and I've raised 140 grand and I'm going to be sitting there and he's going to be sitting there and we're in the same conversation. People are going to want to see him and they're going to leave knowing me. So I'm very excited about this year. So this is us. So, how we get the word out there about prep health. How do we get to where we are? And really, majority of it has been Google. Because people go in there and they search for, why am I itchy? Or how do I treat chlamydia? Or Dr. Google. And I've actually got a great book on it and I can't remember the name. I will, if anyone wants the link, I'll send it to you later. But it's all about understanding what people are asking for and how they're remedying their solutions with Dr. Google. But yeah, we've just through time, credibility, marketing, we've prepped up on the SEO, like we're higher up on the organic rankings, and we've just figured it out. And it's really, if you've ever advertised in these spaces, you'll see that sexual health is really hard to market. It's really censored out of Facebook. You might see some stuff, but it quickly gets shut down. We've been banned before for showing a man and a woman's calves. Like, that's all it was. It was sort of like a little bit of innuendo. But they had shoes on. Like, it was just, they weren't in bed, they were standing. Like, it's just, we got ad banned for that. And then, yeah, and just over, and they should be promoting. I know we need to get some sort of verification. So I'm excited about paid verification and options coming. Other things we're doing, we've advertorials, because unfortunately the LGBTQI newspapers and media won't pick up anything unless you pay for it, which is very frustrating. I want free media. We're going on buses and we've got our first billboard. If anyone drove into town this morning, you might have seen it at Sandgate. And they're about, so people find us online, and we spent the first 6 years going, people would fill out the form, order, pay, and then email me and go, is this a scam? And you're like, no, it's not a scam, we're a legit business, and you have to explain it. But COVID really helped people trust our service, and then I'm finding physical advertising is just making it real. And with that, our AdWords conversion, like our Google conversion cost is down to $7.50 per customer, and that was as high as $150 back in 2016. And recently it was like 13 when I think I was in I2N, and now it's $7.50. So it's a real reflection of those extra costs are really bringing people to our page, and we're converting at 9%. And then similarly, I did spit, so sorry it wasn't that way. I'm pretty proud of this last one, the little needle box, the sticker. I'm going to get bigger stickers, but I've been emailing any time and contacting the big gyms, and they just don't respond. And so I just made a neat little sticker and just started going to any time, because you can go into any one, sticking them up and just saying, roid safe, because there's only about one reason they've got needle bins, and it's not diabetes. It's one reason they've got needle bins in a gym. And it's, steroids. So we're getting out there. We're Australia's largest sexual health service. Now doing Medicare official as of last Thursday. We're doing more than 1 in 37 STI tests in Australia. 30% of our customers report this as their first ever test. So we're really activating. We're creating a market. So if we grow that 764,000 by 30%, what are we? 1.1 million people. But we look at Tinder, we know it's a bigger market. And prep health, we believe we're doing right now 1 in 10 prep prescriptions in the country. So it's really getting there. All right, and then this is our patient growth. We're now over 21,000 patients, 3,500 in prep, and the others in stigma and roid safe. We've been profitable per unit all along, but we actually started paying ourselves in 2021, so we're profitable. We're truly profitable per unit cost. So our break even, we will break even this financial year. We may have a tax bill this financial year, which is the nightmare. I'll figure out how to spend that though, so don't worry. I'm also an accountant before I had restaurants. We got 500 plus reviews, all signs, it should be 600 plus now. And there's a recent article I read by a director of Pemba Partners, and we're not a unicorn, we're a camel. And you want to invest in a camel right now because camels make money, they survive, they go the distance, and that's us, like we're still here. So despite life, despite competitors, and some of our competitors charge half our price, but I know they're not doing as good a job because they've mixed focus, and staying in our domain, we're really conquering it. So yeah, the horizon. We're hoping to get 10 million annualised revenue this year. Recent history says we'll get 3 or 4 million annualised revenue, but we've got a lot of wood in the fire, like we're stoking everything, and which we're going to get there, 10 million annualised revenue. And we want to get to over 10,000 STI, I should say tests a month, because we're not a screening service. And I left the program thinking we will wait till 10 million revenue to get investment, but I've recently discovered that England, not the UK, England has double Australia's population, and it has 4 million tests a year. So it has close to 8 times the amount of testing we have here. So you're looking at our market should be at least 4 times just on comparable, and they still think they need more STI testing. And then further to that, 36% of testing in the UK is initiated online. So we're the biggest here with 3%, and I think 4 to 5% of Australia is online. So I think we've got a chance to get 25 to 30% of the market, become the real leader, and become a real sexual health resource for Australia. And that's why we're actually now starting to go back to look to investors. Interesting, in 2021, after the angel round, I was emailing investors. I think I contacted like over 300 and I got 3 or 4 replies. I've contacted 4 this year, now we're making money, we're a camel, we're sort of in vogue. And I've contacted 4 and I've got 3 responses. So it doesn't mean I've got investment, but it's a different game now, so maybe we've got a chance. Yeah, and I shuffled them around the wrong way, that one.
Thanks so much, Shane.
Thank you.
If you want to grab that stool, more questions that people asked at registration. So we'll lead with a couple of those first, and then I'll hand it to the floor for anyone to ask any questions they might have. So that was a great presentation, and really interesting to hear following your demo night presentation as part of the accelerator last year, just the ups and downs, like the chronological order of how it came to be. It was really fantastic to see. So the first question I've got here is actually from Sarah Wallace from Script, and she's asked, how has experimentation helped you in the growth of your business?
Okay, Sarah also is my mentor in the I2N program, so I'm trying to think of all the examples, but experimentation is just something that's been continuous throughout. So I can think of, we're continually experimenting from everything in your startup. And like initially, when we filled out our form, because the pathology testing is Medicare funded, we'd ask for people's Medicare details. And our conversion rate was only 1%. I stopped asking for Medicare details and just put in the fine print, take your Medicare card to pathology, and our conversion rate went to 3%. So experimentation's like constant to try and increase that conversion rate and decrease our costs. And then we also similarly trialled new services. So I've got that many .health domains. So I had bloke.health, trying to spin off morning.health, trying to work on a women's, we're mostly trying to make the morning after pill accessible. And now I've got visa.health, which actually probably is our next clinic, something to help people without, people in Australia on a visa, because they're really underserviced by the healthcare services. They've got private health insurance, they don't know how to use it, they're just sort of stranded, there's communication barriers, and when we recover fully from pre-COVID times, there's 2.5 million people here on a visa. It's not a small market, so yeah. And that opportunity, they use our service because they find it simple, they can translate the text. Anyway, experimentation's, I guess, everywhere.
I think as part of the accelerator program too, you were probably the founder that came in with the most number of experiments week on week. Like, it was great to see you guys come in and be like, guess what, it was like, I'm sticky, I'm going into Anytime Fitness, I'm just sticking on the side.
I was really motivated. That program was really good for actually, it's probably what got me out of the house, because it's when you're running an online business, it's really easy to sit at home and just try online activities. But after 7 years, I finally went and just raided the uni. Sorry to any uni people here. I got sick of asking for permission to go to the uni, so I just went and did it. And actually, lo and behold, it was O Week. Uni staff were helping me hand out my flyers because they just thought I looked official with my I2N tag. But yeah, I haven't got any angry emails. I went and did the Sydney unis, but yeah, I2N, that got me out of the house. So.
The next question I've got is from Warwick Dawson, and he's asking, well, maybe you've already answered this, what are the benefits of the university connection in growing a startup or a scale-up?
I think it was really, the structure of the program and was really good to formulate, just get all my ducks in a row. I left the program just knowing, with a clearer vision, understanding the possibilities, and you're in the program with great mentors, and you're in the program with great, your colleagues that are going through the program, running their businesses, and you're really feeding off this energy. And I probably could have benefited from getting into a program earlier, but I'm very grateful for the program I got into, and it was just, an awesome experience. I hope that answers it.
Yeah, no, that's great, thank you. Another question I've got here is more technology related. Why is digital health so important, and how can it benefit all Australians?
So digital health, I think, right now it's actually under fire. I think it's being treated as the enemy a bit, but really it's a tool for leverage. So look what we do with two part-time doctors. And I think instead of saying there's not enough Medicare funding for healthcare, or saying there's not enough doctors, why don't we just do things a little smarter? So why can't I be triaged by a form before I see my doctor and get the test before I get there? Get the x-ray before I go. Not go see him, get an x-ray, go back. Let's just skip the steps. I know, and that might lead to unwarranted x-rays, but I don't think it is. Especially things like, I know when I've got an x-ray, I've seen the physio, who's then sent me to the GP, but couldn't he just tell the GP be able to just give me the test? Or couldn't the physio just give it to me? Anyway, I think digital health is going to really just help the healthcare system just be better, just leveraged, more efficient, and then help with just better decision making as well, which is already doing. I'm really excited about the stuff I'm following in artificial intelligence too. I met the guys from Hyphen AI partners Sonic Health, and they've got digital software that reads like a chest x-ray, and it identifies something that doctors don't identify, specialists don't identify. 1 in 30 cases they identify it, and it doesn't get tired, and it can read 10,000 results in 3 seconds. It's not taking away that job, because it doesn't act on it. But it's just a resource to make everyone better. So.
The next question I've got is from Lauren Marks, a student at university, and she's asking, how do you deal with the red tape around anything medical in Australia?
So medical, I work with a GP who has a very successful GP business, so we've really been by the book. We very, very reluctantly pushed boundaries because, his whole livelihood is threatened if we interfere with it, and which is fine. Not to say that I'm unethical and would just break all the boundaries without him. I don't pretend to be a doctor online, but we waited. We contacted. We tried to do the right thing, but I guess we've got scale. We've started to push boundaries a little bit, but I've got one example is. We have women asking we have people asking for tests, like I said before, and tests that the guidelines say they don't need. Now on the guidelines, a heterosexual woman doesn't get an anal or oral swab, but we don't know. You don't know. The guidelines do not know what that woman does. So we made it optional in November after lots of debate and years of debate. We made it optional. It's still on the guidelines saying it's not recommended. And we've had immediate results. We've been able to pick up infections in those sites that we weren't picking up in the other sites. So we will hopefully take this back to the guidelines soon, because it's definitely warranted that people need to have probably a little bit more freedom. And do you want to be telling the doctor about all those intimate details of your sex life? You're doing a form. You look at what people put on Twitter or Instagram. You're a keyboard warrior, and that applies to your health. So. Again, if I've gone away.
No, yeah. That's a really interesting insight that kind of we're seeing a lot more prevalence of. I think just with digital literacy, generally speaking, whether it's social media or otherwise, where people, in different environments and different contexts give over different types of information, and it just shows that the guidelines, like the people writing the guidelines, are probably heterosexual people who probably have one kind of way they do sex.
Yeah.
Do you know what I mean? And it's representative of the guidelines, but the human lived experience is completely different, and you take away that barrier, which can be going to the family GP that you might have seen since you're a kid to talk about your STI test that you think you might need. You're probably not going to give over a lot of that information that is critical for them to, if you have to get a good result back, right?
Yeah, 100%. And we have cases like where people don't want to use a doctor in their town because his wife plays golf with their mum, or like, so we do have a big regional community of support, and then we're big in the cities, and it's breaking that barrier.
Fantastic. I've got another question here from Larry Wilson at Wilson Data Systems, and he's asking, what is being done in the medical profession to meet changing community expectations?
Yeah, I'm a little worried about this one at the moment. So with everything going on, you know, we've never been in a stronger position. We've never been in a more vulnerable position. I contacted the team here and my mentors. So December we had the insurance policies started saying they're not going to insure asynchronous healthcare. So we found our doctors weren't going to be insured from January 1st. And you find that out a week before Christmas. And you know what all brokers and lawyers and accountants, everyone does for Christmas? They take 3 weeks off. So we were, I think I emailed, I said, this is an existential crisis. Like I thought we could be disappearing, and that's not a fun feeling when you've got a young family and you've committed everything and you're doing good work. And so that was an insurance policy change, and then that was followed with the medical guidelines have put their new proposal for guidelines on telehealth, and they've given the guidelines and asked for opinions. Rather than ask for opinions and then build the guidelines, they've given their guidelines which are unsubstantiated, not backed by any academic evidence, not backed by any research. They just literally say that asynchronous healthcare, text-based healthcare is not good medicine, which is not true, because I know that there's articles. I did my MBA during all this too, and I did lots on healthcare leadership, and there are articles and articles that support text-based healthcare for patient activation. So I'm worried the medical community, because now COVID, people expect to see a doctor online. It should be seeing it. It should be able to do it. It should be able to get screened at home. It should be able to do tests. PrEP in the US and UK and STI testing is all done from home, and it's not here yet. And I could get to that too. But so yeah, I actually worry the medical community isn't going the right way. Whether or not it's just the decision makers, because there's a lot of doctors working in telehealth now. I'm not sure. So.
Yeah, I guess there's a huge opportunity to develop up some research that looks at the efficacy of digital health interventions, particularly for vulnerable communities, like people who live in regional areas versus metro, or marginalised communities. I'm really surprised that there isn't more evidence around the efficacy of digital health platforms to service those communities to a positive effect, and then that be reflected in the guidelines.
There is lots of evidence. That's the really disappointing thing. There is lots of evidence supporting what we do. Now, we looked at making a submission to the guidelines, but you know, you need lawyers and you need capital. You need to actually make a decent go of this decision. So we just let the big guys, Eucalyptus, you know, who we share a panel with, we let them make a submission. They made a 50-page submission talking about how good they are, but we're in their coattails. We don't do the same services. We're better than them. They made a 50-page submission and they've slammed them on LinkedIn, and I'm just liking it discreetly and not sharing it. Just, I don't want to be caught up in any, I mean, I'm being a bit of a coward about it because there's so much writing on it. But they're presenting that the decision's been made without evidence. The decision's been made on opinions. It's made and yeah, it's just really, the evidence supports what we do. So.
We've got another question here from Kieran James at Business Sales, and he's asking, if you were able to start over again, what would you do differently when you start up? That chestnut question.
Yeah, I don't think there's like so much in this whole startup is circumstance and luck and timing and poor timing, and I don't think I could do anything different. But if I could do anything different, it would have been work on it full time sooner, make the leap. But young family, other business. I just couldn't. Exiting from business sales, as they know, exiting a business is hard. So I couldn't exit the restaurants easily until I raffled it off. But that didn't come up overnight. So that just start earlier. Again, just make the jump. Yeah.
Yeah, it's an existential crisis. A lot of pre-startups, early stage startups face is, when do I make the leap into the business full time?
Yeah, I only did it when I had to, when I couldn't get a job. I was applying too. I finished work in September 2020, and I was applying for jobs because, again, young family, I was back living with mum and dad at that stage. I couldn't get any responses on jobs. Lo and behold, I got the business off the ground, Prep Health, the second clinic. And in the new year, I started getting job offers. Just like, thanks guys, but I had angel investment and I had a job then. Not much money at that stage, but I was getting money and I was doing what I love. So.
I'm going to hand it to the floor. We've got time for maybe 2 questions. Does anyone have a question they want to ask James?
I do. Hi.
I'm just going to hand you the mic if that's okay, just so we've got it.
Hi there, James. Just one main question, but with health in Newcastle, for example, I know a lot of young people and students are struggling with going to doctors just because everything's becoming more privately billed, and there's slim to no bulk billing now found in Newcastle, which is quite concerning for young people trying to branch out away from their family doctors, trying to see someone new, and they're having to pay exorbitant prices on it. So I do see that there is a field there online for instant scripts, which I believe is a different competitor of yours. So my question is, with more people coming to the web online to find instant scripts and for more competitors to kind of rise up in that space, how do you kind of keep competitive there?
They undercut us by half, but we do have customers who are, and probably our customers are going that way too, but we have customers openly coming to us and telling us we just do a better job. And it just there's a lot of, part of the red tape too was, there's 10,000 pathology clinics and every health region has a different software system or a different way of doing things. And we, over those long 7 years, we've integrated with all of them, and I know there's pathology companies that just refuse instant scripts. But that might not be forever. And we just focus on that. We are focused on the sexual health, and we're not selling them anything else for the moment. We just, I know more to the sector will just make it more popular, but we're also more of a sexual health resource. We're building, more advisory services, there'll be more resources in the future. So I guess our niche focus is our way we're competing. Yeah.
Thanks for that, James. It was amazing listening to your story, and it's always a brave journey. So I salute you on that. One thing I'm curious about is you're scaling up. So what are the capability gaps? Who are the people that you're looking for to join your team and be part of your story, your next chapter?
It's a good question. So we're scaling now. We've added 1,400 new patients in February. It was 1,500 patients in January. That extra 3 days helps. We're really getting there, and then I guess the capability. We really run lean. I think we could do with the team we've got until that 10 million target turnover, but we probably do need to add another doctor. A dedicated doctor would be amazing, but whether or not I can find someone who's interested in working so pigeonholed, so niche. So that's probably a capability gap there. And then technology-wise, I think we've got the team we're working with. It's great. And then probably our next thing, if we do raise investment, is really just growth and activation, getting the awareness. In addition to a doctor, we're looking at a nurse practitioner to have just more capabilities on the phone too, because I get people ringing all the time for sexual health advice, and I can't give it. I don't pretend to give any healthcare advice. They get directed to us by health services, but they're meant to be directed to our website. I can point people in the right direction though, which is no problem, but I would just love to be able to do more. So that's probably our 2 main highs. Yep.
Well, if you can please have a round of applause for James.